Hello, my name is Jenna Godo, and I'm the Outreach and Communications Coordinator for the Maine Opioid Settlement Support Center, or MOS Center for short. We are a project of the Substance Use Research and Evaluation Team at the Cutler Institute at the University of Southern Maine. I'm going to be working through the soon-to-be-released 2025 Opioid Settlement Fund Annual Report that will be distributed to all subdivisions on December 1st. This report has been developed by the Moss Center with support from a Maine Attorney General's office. To help simplify the process, standardize and increase transparency in all of our opioid settlement spending in the state of Maine. Completing the required information in this report meets the reporting requirements established in LD 110, and you do not need to submit additional information to the Attorney General's office. This survey is due on January 15th, 2026 by 11:59 p.m. For any questions you have, please reach out via email to the email displayed at the beginning of the survey here. Additionally, a PDF of the survey is also available for download for your prepping or planning purposes. However, the report must be filled out electronically to be considered completed. We will be compiling this information and providing it to the Maine Attorney General's office on behalf of your subdivision. Once the data is finalized, it will also be shared on the Moss Center website dashboard. Specifically, what is asked in this report is outlined here. We have indicated what is mandatory and what is preferred. Contact information is mandatory. The 2025 process information is preferred. The 2025 spending information is mandatory. And the 2022 to 2024 spending and process information is preferred. At the end of the report completion, you will be able to download a copy of your responses for your records. For the purpose of training, we will be completing the form with mock information to demonstrate report completion. To begin, you are going to certify that you are the proper and only representative to complete the annual report for the Opioid Settlement Funds for your subdivision. We are only accepting one report per subdivision. If you do not believe you are the correct person, you may forward the email to the proper designee. If you are wondering who will be receiving this for your subdivision, please contact us. Next, you are then going to complete the name of the person, your job title, contact number, and contact email. As you move to the next section, the first series of questions asked about the 2025 Opioid Settlement Fund subdivision infrastructure, community engagement processes, tracking and evaluation methods, transparency practices, and spending decisions. To reinforce, completing the required questions in this section will fulfill your legal requirements established in LD 110. The Moss Center is asking subdivisions about key aspects of their settlement funds decision-making beyond what is required in LD 110 to promote transparency, keep communities informed, and create an opportunity for shared learning. You are not required to fill out sections of the report beyond what is asked for in LD 110, although it is encouraged for transparency purposes. The first section, subdivision decision making. The first question, we are interested in understanding who the key decision makers are, the level of support they receive, and whether there are formal policies or procedures in place that guide your actions. The question is really asking who has the final say in deciding how the funds will be distributed. Perhaps you have county commissioners who have the final say, but you have a task force that supports them. Your response will be county commissioners, and there is an opportunity in the next question to share who makes recommendations. Who is supporting or advising decision makers in the planning process and spending decision? As mentioned in the previous question, for example, if you had a task force or a committee, this is where you would select them. Or perhaps you meet with individuals, check all that apply, and if you need to select other, please specify who in your response. For the third question, is there a formal policy or ordinance in place establishing your subdivision's plans for distributing funding? This is specific to something that either city, town, or county has created as an official designation or determination of process and/or expenditures, ensuring the funds are being spent as intended on an ongoing basis or per the terms of the policy. This next section aims to gather insight into how your subdivision interacted with your community and gather data to inform the Opioid Settlement Fund planning processes in 2025. The first question, has your subdivision hosted any community engagement activities to help inform their spending decisions? Community engagement includes providing other opportunities for input from community members and professionals in addition to formal decision makers like a task force or a council. For example, providing a chance for public comment at committee meetings would be considered a community engagement opportunity. However, simply allowing public attendance at a meeting is an example of transparency, not engagement. This is a check all that apply. You may have done several of these options or none. The second question, was any evidence utilized to guide your subdivision spending decision? If you used any other data source or information that you do not feel fits into one of these categories, please select other and specify. And please check all that assisted in your decision-making process. So moving to the next section, this focuses on whether your subdivision is tracking and evaluating the settlement fund projects, purchases, and positions funded. For example, if entities were funded, they agreed upon a spending plan and are completing agreed upon goals, is this being tracked somehow? And overall, are you in some way ensuring that the outcomes and goals of spending align with the approved uses of funds? First question, does your subdivision monitor to see if the opioid settlement fund spending is achieving their intended outcomes? If you select no or unsure, you will be moved to the next section of the report. If you select yes, you will have some additional questions that gather more information, which we will do. So the next question, if you responded yes to the tracking and evaluation, this first thing, what monitoring and evaluation measures are in place? The first option is asking if project-specific goals and outcomes are measured. These would describe what success looks like for that particular project and how it would be evaluated. The other option is regular reporting from the entity receiving the funds. Is specific to when the organization provides the funder a summary of activities, expenditures, and progress. If both apply, select all relevant options. The next question, what portion of your subdivision's projects, purchases, or positions are monitoring intended outcomes? This is broken down into an all, most, or some. Please select one. Moving to the next section, it seeks to understand the approach to communication and transparency your subdivision has taken to share Opioid Settlement Fund related processes and decisions with the public. The first question is asking, in addition to completing the survey, is there a mechanism in place for your subdivision to share these decisions? This is a check all that apply. For example, you may have an opioid settlement fund designated section on your county, your city, or town website where you post meeting notes. The next section, spending decisions. This is a required section. The goal is to understand how and where the funds are being spent. The first question is simply yes or no. Did your subdivision spend any opioid settlement funds in 2025? Let's work through both options. If you were to enter no, you would have an opportunity to share why you have not spent any opioid settlement funds this year. But we are going to go back and select yes, and we will run through several examples. So when you select yes, you will be able to submit information for multiple expenditures, and an expenditure is a project, purchase, or position filled using opioid settlement funds. Expenditure descriptions should include the intended purpose of the spending, communities and populations served, and the length of the project or the position of the funding. And you will be asked to provide the project purchase title, the amount of funds spent on the project, and the entity receiving the funds. Again, this is a required section. For our first example, you can see we are going to give purchase of medication for opioid use disorder in the county jail with the amount of settlement spent $75,000. And then the entity receiving the funds is the county jail. Please be specific as to which county is in your response or a specific entity. Then in the description, you would want to be specific about the intended purpose of the spending, population served, or length of the funding. For our example description, this purchase supplied 35 doses of Sublocade, a monthly injection for participants being treated for opioid use disorder in the jail. This identifies the purpose of the spending and the population served. The jail is currently treating an average of 3 people per month, therefore anticipating this purchase to last approximately 1 year. That funding will be revisited annually. This identifies the length of the funding. If you have any additional expenditure, select yes. If not, select no, and you will proceed to the next section. For our next example, we'll be doing a project of Narcan vending machines in the community. The amount spent was $6,000, and the entity receiving is the community center. And you'll want to be specific as to which specific community center. For the example, the Narcan vending machine aims to increase public access to opioid overdose reversal medication at the community center. This is the purpose. The machine will dispense Narcan kits and educational materials to individuals at risk of overdose, their loved ones, and the community members who may encounter an opioid emergency. This identifies the population served. Planning, installation, and initial announcements took 3 months, but this is an ongoing project and we plan to allocate funds to refill the vending machines annually. This shows the length of the project funding. We will show one more example, selecting yes. Example 3, we are going to assume the funding went to a staff position. We will say the position is a community health liaison. This includes all expenses related to this role. The cost will be $90,000, and the entity receiving the funds will be a private organization or the city or town in which the position is held. We will use community organization as an example. Please be specific as to which community organization. For our example description, the community health liaison is intending to serve unhoused individuals at high risk for substance use disorders. This identifies the population served. The community health liaison will be providing harm reduction resources, referrals to healthcare, and treatment as needed. This identifies the purpose. This position is intended to be funded for the next 5 years to later be absorbed by the town budget if deemed necessary at that time. This highlights the length of the project funding. So now for any additional expenditures, we are going to say no and move to the last question related to the 2025 spending. What is the total amount of spent funds in 2025? So this is distributed funds in 2025 by your subdivision. If you did not spend any opioid settlement funds and you answered no previously, put a 0. For our examples, adding up all of our numbers, our total would be $171,000. The next question, what is the amount of opioid settlement funds that is currently unspent? This number is inclusive of all funds received between 2022 and 2025. The next portion of the reporting survey is successes and challenges for 2025. We are interested in hearing about the achievements that have positively impacted your subdivision, as well as any obstacles or challenges faced along the way. Your work and lessons learned are valuable, and sharing here allows us to strengthen the collective effort to address the opioid crisis effectively to help other communities learn from your experience. The final question in this section is an opportunity for you to add any additional information that doesn't necessarily feel like a success or a challenge. It could be a general observation of how the process has been for your community. As we move to the next series of questions, we seek to gain an understanding of your subdivision's 2022 to 2024 settlement fund spending. Since the settlement fund payments started going out to subdivisions in 2022, we really wanted to provide an opportunity to gather information about your process and decisions prior to the 2025 reporting year. The process questions in this section are the same as the questions asked in the 2025 spending section. These responses may all be the same or they may be different. So first, we ask for the previous year's decision makers, who supported the decision makers, any formal ordinances or policies surrounding settlement funds process or spending. Next, we have community engagement activities that helped inform spending. Moving down to the next, was any evidence used to help make spending decisions? And the next is specific to transparency of processes and decisions made for the 2022-2024 funds. Now continuing down, was there an evaluation plan to measure if the spending is achieved its intended outcomes? Similar to the 2025 evaluation question, if you select no or unsure, you will be moved to the next section of the report. If you select yes, you will have some additional questions that gather more information. This will look familiar. Please check off which monitoring and evaluation activities your subdivision was participating in, and select what portion of your expenditures were being evaluated. Finally, we are in the final stages of the report. Did your subdivision spend any funds in 2022 through 2024? If the answer is no, you will have the same opportunity as earlier in the report to share why you did not spend any funds and the opportunity to share successes and challenges as well. And if your answer was yes, the Moss Center has gathered past spending information for you. We have collected this through meetings, announcements, updates on websites, news articles, with the intention of aiding your spending information in the past years. That information will be displayed in the blank box that you currently see. It will be subdivision specific. So please review that information and provide any corrections or further information as necessary. If it is inaccurate or there is more information to provide, you'll have the opportunity to update your summary of spending. We also are providing another opportunity to share success and challenge highlights from 2022 to 2024, as well as a chance to share anything additional. Thank you for taking the time to listen to this webinar. If you would like a copy of your responses, please download the PDF available now. We will host a live webinar on December 4th at 11:30 a.m. to walk through the reporting tool and answer questions. The reporting tool will be sent to subdivisions from the Moss Center email on December 1st, 2025. The email you received with this recording also includes a link to sign up for the December 4th webinar. Our team is also available for one-on-one support. Please reach out to the Moss Center and we can set up a meeting time to help you walk through your reporting if you have any specific questions. Again, this reporting tool is due on January 15th, 2026 by 11:59 p.m. If the report is not submitted by this time, you will be responsible for submitting the required Opioid Settlement Fund spending information to the Maine Attorney General's office directly. Thank you for your time, and we hope this was helpful to you.